Chromhidrosis is a very rare skin condition where a person's sweat looks colored like red, blue, green, or black, instead of being clear. It usually happens in areas that have apocrine sweat glands, such as the armpits, face, or chest. Think of it like a natural watercolor painting that appears when you sweat. The color comes from a pigment called lipofuscin that builds up inside the apocrine glands. This can happen on its own, or it can be triggered by certain medicines. For example, some chemotherapy drugs, skin infections, or disorders that affect hormone levels. Imagine a tiny factory inside the gland that accidentally starts producing colored paint instead of plain sweat. People with chromhidrosis notice that the sweat from specific spots looks colored. The sweat may be oily, and the color can range from pink to deep brown. Usually there is no itching or pain, just the surprise of seeing colored sweat. For example, after a workout, you might see a reddish stain on your shirt instead of the usual yellow-white sweat spots. Doctors first look at the colored sweat and ask about medicines or other health issues. They may collect a small sample of sweat to test for the lipofuscin pigment and to rule out infections. Treatment often involves topical antibiotics like clindamycin to reduce the pigment-producing bacteria, Botox injections to limit sweating, or laser therapy to destroy the pigment-filled glands. Simple skin cleaning and wearing breathable clothes also help. To keep chromhidrosis from getting worse, avoid known triggers such as certain drugs, keep the affected areas clean and dry, and use gentle soaps. Wearing cotton clothing and letting the skin breathe can reduce the amount of sweat, which lessens the chance for pigment to build up. Recent studies have explored the use of low-energy laser treatment and intense pulsed light, IPL, to safely break down the pigment inside the glands. Researchers are also investigating why some people's glands produce lipofuscin and how genetics might play a role. These advances could lead to quicker, less invasive ways to clear the colored sweat.